Hypertension in South Africa is a huge problem and is the number one killer in adults concerning cardiovascular disease. And the problem with hypertension in South Africa is that almost half of the population are living with high blood pressure. And half of those people are aware that they have blood pressure problems, while the other half do not know that they have hypertension. And some of them have never had their blood pressure checked. And those who are receiving treatment and know that they have hypertension do not have proper control of their blood pressure. So they are not taking their medication routinely, and the medication is not working effectively, or when they feel that the blood pressure is normal because of the medication, they stop their medication. So there's a huge problem in terms of patient counseling in South Africa between the doctor and the patient to understand the issues related to taking high blood pressure medication, and to make sure that you adhere to the dosage that has been prescribed, and also to follow healthy lifestyle behaviors. Now, we have several circumstances in South Africa that makes it a bit more complicated, which includes the rural areas that are quite far away from clinics and hospitals. So we do not really know what the awareness rates or the hypertension prevalence are in certain rural areas in the country. So those particular people in the rural areas need to be screened so that we can understand what is their circumstances and also optimize care for such individuals. Now, in terms of adherence and drug availability, that is also some of the problems that we see in hospitals and clinics, that treat the correct treatment. The drugs are not always available. And also the misconception of high blood pressure development that starts in childhood and continues throughout adulthood should be addressed, because there are already children living with hypertension and they are not screened routinely. And it's a general thought that a child is healthy, so they will not present with adult disease, but in reality, children already also have high blood pressure. The hypertension problem in Africa is definitely similar to that in South Africa and globally, where the awareness of hypertension is still a big problem, as well as the prevalence of hypertension. But there are smaller communities and countries in Africa that is protected from the harms of hypertension because of the lack of industrialization, and also that the people living there do not have access to fast foods and unhealthy lifestyles. So they are still very physically active. They do not have access to unhealthy foods. They plant their own organic food, and that is why they are protected against the harms of the risk factors that we know cause hypertension. Well, the education on blood pressure monitoring in South Africa is not optimal. Medical students are trained how to take a blood pressure measurement, but they are not taught the specific technical aspects of taking care of a blood pressure device, whether a blood pressure device is validated or not, and to learn more about the cuff sizes that they have to use, as well as the calibration of devices. So there's a lot of information that is lacking in the educational part of teaching a medical student how to take a proper blood pressure measurement. As well as in general practice, we see that the GPs only take one blood pressure measurement and then they diagnose hypertension, which is not following the guidelines. So there's a huge disconnect between what is available, the protocols available, the guidelines available, and what is actually practiced in the clinics. So there's a lot of work to be done in terms of optimizing blood pressure monitoring and care for patients, and also to educate not only patients but also the GPs. And I think for enrichment, GPs need to attend these type of seminars and workshops in order to stay up to date with the latest guidelines and also how to take care of their blood pressure monitors.